Well, as you just heard, leading medical experts, including Dr. Fauci, fear a second wave of the coronavirus pandemic is inevitable. Local 12's Duane Pullman investigates the science behind the fears.
Like many of you, I'm continuing to stay right here at home. But as stay-at-home orders begin to be lifted across the country, many of us will soon have to venture back out there. And that, top doctors say, all but guarantees a second wave of COVID-19 cases. After months of empty streets and sheltering at home,
end this darn shutdown. It's unconstitutional.
Growing calls to end lockdowns have triggered a slow reopening of the U.S. People stuck inside begin to wade out in public again.
I've been cooped up for the last 7 weeks.
But COVID-19 is still a threat. Even the nation's top infectious disease doctor fears the loosening restrictions in many states could trigger the so-called second wave of COVID-19. This is what Dr. Anthony Fauci said before he went into self-quarantine.
There may be some setbacks. I mean, let's face it, this is uncharted water.
Data specialists say the combination of loose restrictions and clusters of COVID-19 will likely bring a new spike.
We think that for many states that are reopening, that there will be potentially an increase in the number of infections as a result of this reopening.
As the overall curve of new cases is going down, hotspots continue to pop up across America. Last week, the New York Times published this graph showing a drop in the number of new COVID-19 cases in the U.S. since early April, when stay-at-home orders began. But that's not a complete picture. When the Times took the New York City area out of the count, the graph clearly showed the number of coronavirus cases across America continuing to rise. Yet the same sections of the country with increasing cases are easing restrictions. Dr. Ali Khan, CDC's former director of public health preparedness and response, told NPR's Morning Edition last week 90% of America is probably still susceptible to new outbreaks of COVID-19, which means, Dr. Khan says, a lot of separate outbreaks will feel like sort of a second wave coming. As states began easing restrictions, the Institute for Health Metrics and Evaluation at the University of Washington revised its model for deaths from coronavirus, now forecasting 137,184 people in the U.S. will die from COVID-19 by August 4th. That's nearly double the 72,433 that were predicted. So if you said a second wave is on the way, unfortunately, you're probably right. But remember, these are predictions, so we can still change the future. If we continue to wear masks and practice social distancing, top doctors and health experts say that wave might not be so big. I'm Duane Pullman.